You're just starting your NBME form, and a long Step 1 question appears on the screen. It gives you the patient's age, symptoms, laboratory results, medications, family history, and 5 answer choices that all seem vaguely possible. So you start searching your memory for a disease name. You think of one diagnosis, then another, and before long, the entire question feels like a pile of unrelated facts. Let's face it, we've all been there. But what if your first move should not be identifying the disease? What if your first move should simply be asking, what kind of problem is this? That's the idea behind the MDSteps Step 1 bucket system. The bucket system is a concept we introduced on Reddit back in 2025, and it's helped hundreds of students classify questions better. Hi, I'm Michael, founder of MDSteps. One of the biggest problems students run into on Step 1 is trying to process every clue in a question at the same time. They read the stem, search their memory for a diagnosis, notice an answer choice they recognize, and then try to force the rest of the question to fit. The bucket system changes that sequence. Instead of immediately asking, "What disease is this?" you first ask, "Which broad category or bucket does this question belong to? Is this an immunodeficiency, an anemia, shock state, acid-base disorder, or maybe a lesion localization question or obstructive lung pattern?" Once you identify the category, you are no longer comparing 5 random answer choices. You are working inside a much smaller and more organized differential. That lowers the amount of information you have to hold in your head and makes the important clues easier to recognize. The bucket system has 4 basic steps. Step 1. Recognize the pattern. Before trying to name a specific disease, ask what broad clinical problem the stem is describing. For example, is the patient experiencing recurrent infections? Is a pattern of hemolysis present? What about a perfusion problem? Or is the question asking you to localize a neurologic lesion? You are not solving the question yet. You are simply organizing it. Step 2. Choose the bucket. Once you recognize the broad pattern, name the category. For recurrent infections, the bucket might be B-cell deficiency, T-cell deficiency, combined immunodeficiency, complement deficiency, or phagocyte dysfunction. For anemia, the first bucket may be microcytic, normocytic, macrocytic, or hemolytic. For kidney injury, it may be pre-renal, intrinsic, or post-renal. Moving on to Step 3, find the pivot clue. Now look for the clue that separates the most likely bucket from the closest alternative. This is usually not the most dramatic clue in the question. It is the most discriminating clue. And finally, Step 4, commit. Once the bucket and pivot clue agree, answer from that narrowed differential. Do not reopen every possible diagnosis just because one of the distractors sounds familiar. The sequence is pattern, bucket, pivot clue, commit. Now, let's go through some examples so you can see it in action. Imagine a young child with recurrent sinus infections, pneumonia, and infections caused by encapsulated bacteria. The common approach is to immediately search for the name of a specific immunodeficiency, but first choose the bucket. The dominant pattern is recurrent extracellular bacterial infection, particularly with encapsulated organisms. That places the question in the humoral or B-cell deficiency bucket. Now the remaining clues, such as low immunoglobulins, absent tonsils, or giardia, help you select the specific diagnosis. Compare that with a child who has persistent thrush, viral infections, fungal disease, or pneumocystis pneumonia. That pattern belongs in the T-cell deficiency bucket. The key is not memorizing a giant list of immunodeficiencies all at once. The first move is identifying which arm of the immune system is failing. Now, let's move on to a neurology example. Neurology questions become overwhelming when students try to diagnose the disease before localizing the lesion. Suppose a patient has weakness and sensory changes. Before thinking about a named condition, ask, is this central or peripheral? Are there upper or lower motor neuron signs? Is there a sensory level? Are there crossed findings involving the face on one side and the body on the other? Crossed face and body findings point you toward the brainstem bucket. A sensory level points toward the spinal cord. Face and arm weakness with aphasia may place you in an MCA territory bucket, while predominant leg weakness suggests ACA involvement. In neurology, your first answer is often not a disease. It is a location. Localize first, diagnose second. Moving on, let's take a look at a renal example. Now imagine a patient with a rising creatinine. There are many possible causes, but the first bucket is simple. Is the kidney injury pre-renal, intrinsic, or post-renal? You then use the supporting clues. Poor perfusion, a low fractional excretion of sodium, or an elevated BUN to creatinine ratio supports a pre-renal process. Muddy brown casts suggest intrinsic tubular injury. Hydronephrosis or urinary obstruction points toward a post-renal cause. Without the bucket, every lab value feels like another fact you need to interpret independently. With the bucket, the laboratory values become evidence for or against one of three broad categories. The same process works with acid-base questions. Start with the pH. Then determine whether carbon dioxide or bicarbonate is driving the disturbance. Then evaluate compensation. Then, when appropriate, calculate the anion gap. The order matters because physiology questions are often solved through sequence rather than isolated memorization. And finally, let's run through a quick anemia example. A patient has fatigue, pallor, and an abnormal hemoglobin level. Before searching for the disease, start with the MCV. Is the anemia microcytic, normocytic, or macrocytic? Then use the reticulocyte count and peripheral smear to narrow the bucket. If there is jaundice, elevated LDH, increased indirect bilirubin, and low haptoglobin, the question is moving into the hemolysis bucket. Now you can ask whether the hemolysis is intravascular or extravascular, inherited or acquired, immune or non-immune. But you do not need to process every anemia diagnosis simultaneously. You classify first, then determine the cause. The bucket system only works when you force yourself to use it before seeing where the explanation takes you. Here is how to practice it during your next question block. After reading the first few clues, pause. Before committing to a disease, say the broad bucket out loud or write it down. For example, B-cell deficiency, nephritic syndrome, obstructive lung disease, macrocytic anemia, MCA territory. Then read the rest of the question and look for the pivot clue that confirms or challenges your initial classification. If you miss the question, do not only ask, "What fact did I forget?" Ask yourself, "Did I choose the wrong bucket? Did I identify the correct bucket but miss the pivot clue? Can I recognize the pattern? Or was this genuinely a content gap?" That distinction matters because each type of error requires a different correction. The biggest mistake is turning the bucket system into another passive study resource. Students read a list of patterns after completing a question and think, "Okay, that makes sense." But recognition during review is not the same as recognition under test conditions. The value comes from predicting the bucket before reading the explanation, and ideally before allowing the answer choices to influence your reasoning. A bucket is not another list to memorize. It is a mental pause that helps you organize the question before you chase a diagnosis. Step 1 contains an enormous amount of information, but individual questions are rarely asking you to recall every fact you know. They are asking you to recognize a pattern, classify the problem, identify the discriminating clue, and make a decision. So during your next block, stop making the disease your first move. Remember the sequence: pattern, bucket, pivot clue, commit. We have a complete free Step 1 bucket system guide at MDSteps.com covering immunology, genetics, neurology, cardiovascular, renal, pulmonary, GI, hematology, endocrine, psychiatry, and pharmacology. And when you are ready to test the method, you can complete a free step-style diagnostic on our website. After you answer, MDSteps will show you the pivot clue, why your selected answer was tempting, where that answer breaks, and the rule you can use on the next question. You can find both links in the description. I'll see you in the next video.